Today we're talking about 5 specific nail changes that have a real documented connection to heart health. This isn't folk medicine or old wives' tales. These are clinical signs that cardiologists are trained to look for, signs that appear in medical literature, in diagnostic guidelines, and in real patients who came in thinking nothing was wrong. We're going to go through all 5, ranked from the ones that are simply worth knowing about, all the way up to number 1, which is the sign I consider the most important of all. And I'll tell you exactly what to look for, what it might mean, and what to actually say to your doctor. If you're over 50, or if you have any family history of heart disease, I especially want you to stay through to the end. Because the sign at number 1 is something most people have never heard of, and it can reveal a cardiac event that happened without you even knowing it. My name is Dr. Emily Carter, the first Nanines V. Spent nearly 2 decades focused on preventive cardiovascular medicine, working specifically with adults in the 50 and over age group. My goal on this channel is simple: to translate clinical knowledge into plain, practical language so that you can show up to your doctor's appointments better prepared, more informed, and asking the right questions. Everything I share here is based on published medical research. I'll always tell you when something is uncertain, when a sign has multiple possible explanations, and when something needs professional evaluation, not just a YouTube video. Let's begin. Starting with number 5. Sign 5, pale or colorless nail beds. Here's something I want you to try right now. Press firmly on the nail of your index finger, hold it for 2 seconds, then release it. Watch what happens beneath the nail surface. The area you pressed should go white, and then within about 2 seconds, the pinkish color should return. That return of color is your blood rushing back in. And that healthy pink color you're looking for, it comes from a dense network of tiny capillaries running just beneath the nail plate. Now, what if those nails have been looking pale or almost colorless for weeks? What if pressing and releasing shows a slow, sluggish return of color? That's where the conversation about heart health begins. What pale nail beds can indicate: when your heart's pumping efficiency starts to decline, even gradually, even before you feel anything, your body responds in a very specific way. It quietly redirects blood toward the organs it considers most critical: the brain, the kidneys, the heart itself. The hands and feet, being at the far ends of your circulation, are among the first to receive less blood flow, and your nails show that reduction. Now, I want to be careful here, because pale nail beds are not exclusively a cardiac sign. Anemia, low iron, vitamin B12 deficiency, and certain autoimmune conditions can all produce this appearance. So this finding alone is not cause for alarm. But here's when it becomes worth taking seriously. If your nail beds have gradually become paler over several months, and your hands feel consistently cold even in warm environments, and you've noticed that physical activity tires you more quickly than it used to, that combination is worth raising with your physician. There's a simple clinical assessment called capillary refill time, the same press and release you just tried. Doctors use this routinely to assess peripheral circulation and cardiac output. It takes about 5 seconds and tells a great deal. If you're currently on blood pressure medications, diuretics, or blood thinners, which are very common after age 60, mention this when discussing any nail changes. These medications can themselves affect how circulation appears in the extremities. Sign 4, clubbing of the fingertips. This next sign is one of the slowest to develop, which is exactly why it's so easy to miss. Nail clubbing refers to a gradual change in the shape of the fingertip itself. The soft tissue beneath and around the nail slowly enlarges. The tip of the finger becomes rounded, almost bulbous, and the nail, following the tissue underneath it, begins to curve downward, like it's wrapping around the end of the finger. Most people don't notice it happening. They might look at an old photograph years later and see that their fingertips have changed shape, but by then the change has been there for a long time. Why does this happen? The leading explanation centers on chronically reduced oxygen delivery to the tissues. When blood isn't carrying enough oxygen, whether because the lungs aren't functioning optimally, or because the heart isn't pushing blood with adequate force, the body compensates by increasing blood flow to the fingertips over a sustained period. That persistent increase causes the tissue to grow and thicken. The nail follows. From a cardiovascular perspective, clubbing is documented in several specific conditions: congenital heart defects, structural abnormalities present from birth that may have been mild enough to go undetected for decades, valve disease and infective endocarditis, which we'll discuss in more detail in a moment, chronic heart failure, where reduced cardiac output creates persistent low oxygen states in peripheral tissues. Clubbing also appears in chronic lung disease and some inflammatory conditions, so it's not an exclusively cardiac sign. But the key point is this: Unexplained clubbing always warrants evaluation. It should never simply be dismissed as a feature of normal aging. Practical check you can do now. Hold your 2 index fingers together, nail to nail. There should be a small diamond-shaped gap between them where the nails meet. In people with significant clubbing, this gap disappears. This is called the Shamroth window test, and while it's not a diagnostic tool, it can help you notice whether something has changed. If you're already managing atrial fibrillation, valve disease, or any diagnosed heart condition, don't wait for a routine appointment if you notice clubbing that wasn't there before. Request a timely conversation with your cardiologist. Sign #3, splinter hemorrhages under the nails. Take a very close look at your nails right now, specifically near the tip of each one. Do you see any thin, dark streaks running vertically beneath the nail surface? Lines so fine they look almost like a tiny splinter embedded under the nail? These are called splinter hemorrhages, and they have a cardiovascular connection that is taken very seriously in clinical medicine. What are they exactly? They're tiny bleeds in the capillaries that run beneath the nail plate. They appear as dark reddish-brown lines, usually near the free edge of the nail, and they are completely painless. They can appear on fingernails or toenails. Here's the critical distinction. A single splinter hemorrhage on one nail, especially if you work with your hands, garden regularly, or recently bumped that finger, is almost always the result of minor trauma. That's not what we're concerned about. What matters clinically is this: multiple unexplained splinter hemorrhages across several different nails with no history of trauma. That is a different situation entirely. The cardiovascular connection. In the medical world, splinter hemorrhages are formally included in the diagnostic criteria for a condition called infective endocarditis, a bacterial infection of the inner lining of the heart, particularly the heart valves. Here's how it works. When bacteria enter the bloodstream and attach to a heart valve, they form small clusters called vegetations. Fragments of these clusters can break off, travel through the bloodstream, and lodge in small vessels throughout the body, including the capillaries beneath your nails. The result? Those characteristic dark streaks. Infective endocarditis is not common, but it is serious, and it responds dramatically better to early treatment than to delayed diagnosis. Important scenario to know: if you've recently had a dental procedure, a urinary tract infection, a skin infection, or any medical procedure that may have introduced bacteria into the bloodstream, and within 1 to 2 weeks you notice multiple dark streaks under several nails, combined with a low-grade fever, unusual fatigue, or generally feeling unwell, that is a situation that warrants a call to your doctor within the same week. Not necessarily an emergency room visit for nail findings alone, but a real specific conversation sooner rather than later. If you are currently on anticoagulant medication, mention this promptly, as it affects how any underlying condition may present. Sign #2, Terry's nails, white nails with a pink band. We're moving now into nail signs with a more direct connection to established cardiovascular disease, and sign number 2 is one that I think more people need to be aware of. The condition is called Terry's nails, and it has a very recognizable appearance once you know what to look for. What it looks like. Almost the entire nail appears white, not pale, not slightly off color, but genuinely white or very light gray. The normal pinkish color is almost completely absent from the bulk of the nail. The only exception is a narrow band near the very tip of the nail, usually somewhere between 1 and 3 millimeters wide, where normal coloring persists. Where does this come from? The condition was first described and documented by a physician named Dr. Richard Terry in 1954, who identified it consistently in patients with severe liver disease. Since then, research has expanded our understanding significantly, and congestive heart failure is now one of the most well-studied conditions associated with Terry's nails. Here's the physiological explanation. In congestive heart failure, the heart's ability to pump blood forward is significantly reduced. Fluid accumulates in the lungs, in the abdomen, in the legs. The body undergoes widespread changes in fluid balance, protein levels, and circulation. One of the effects of these changes is abnormal fluid accumulation in the nail bed tissue itself, which disrupts the normal capillary structure beneath the nail and causes that characteristic white appearance with only a thin strip of normal color at the tip. Research studies estimate that Terry's nails appear in roughly 25 to 40% of patients with congestive heart failure, though figures vary between populations and study designs. Other conditions associated with Terry's nails include chronic kidney disease, type 2 diabetes, and significant nutritional deficiencies. Why does this matter practically? Many older adults living with early to moderate heart failure haven't been fully worked up. They've been told things like your heart is a little weak or watch your salt intake, but the broader picture hasn't been thoroughly investigated. If you or someone you care about has nails that appear predominantly white with only a narrow band of color at the tip, and there is any existing history of cardiovascular disease, high blood pressure, kidney problems, or diabetes, that specific nail finding is worth bringing up explicitly with your doctor. Take a moment to look at the hands of people close to you as well. We often notice changes in others before we catch them in ourselves. Sign #1, Bowes lines, horizontal ridges across the nail. And here we are, number 1. The sign that, in my clinical experience, produces the most genuine surprise, because of what it can tell you and because of what it might have already recorded. What are Bowes lines? They are horizontal grooves or indentations that run across the nail from one side to the other. They cut perpendicular to the direction of nail growth. I want to be clear about what they are not. Vertical ridges that run lengthwise along the nail are extremely common and generally harmless, a typical feature of aging nails. We are not talking about those. Bowes lines are distinctly different. They run across the nail horizontally. They appear as visible grooves or dents. And this is the key detail. When a significant event has occurred, they typically appear on multiple nails at the same time, at roughly the same position on each nail. Why do they form? Your nails grow from a structure called the nail matrix, the living tissue tucked beneath the base of each nail. Under normal conditions, nail growth is steady and continuous. But when the body experiences a major physical shock, a serious illness, a severe infection, major surgery, or a significant cardiovascular event, nail growth slows dramatically or pauses entirely. When growth resumes, the interruption leaves a physical groove across the nail surface. That groove is the Bowes line, and it remains visible as the nail grows out over the following months. The cardiovascular significance, and this is the part that matters most. Heart attacks, severe episodes of heart failure, and major cardiac arrhythmias are exactly the type of physiological shocks that produce these grooves, which means Bowes lines can appear following a cardiac event that the person never recognized as a cardiac event. Silent heart attacks are significantly more common than most people realize. Research estimates suggest that between 45 and 60% of heart attacks occur without the classic crushing chest pain we associate with them, particularly in older women and in people with diabetes. Instead, the person may have experienced unusual fatigue that lasted a few weeks, a sense of indigestion that didn't fully resolve, breathlessness they attributed to a cold, or just an unexplained period of feeling off. The heart underwent an event, the body registered it, and the nails recorded it, faithfully, accurately, and permanently, in the form of a horizontal groove. The timing can even be estimated. Because nails grow at approximately 3 millimeters per month, you can roughly calculate when the event occurred based on where the Bowes line sits on the nail. A groove near the base of the nail points to something that happened relatively recently. A groove near the tip suggests an event several months in the past. What to do if you see this? Look at all 10 fingers right now in good light. If you see horizontal grooves crossing multiple nails at roughly the same position, write it down. Note where the groove sits relative to the base and tip of the nail. Then bring that information to your cardiologist or primary care physician. Ask them to help you think through what was happening in the weeks before that groove appeared. Was there an illness? A period of unusual fatigue? A stressful event? Give them the full picture. This is the nail finding that most consistently leads to important conversations that might not have happened otherwise. Let's bring it together. Your body has been communicating with you for a long time, quietly, through changes that are easy to overlook, easy to attribute to age, easy to dismiss. Today we covered 5 specific things to look at: pale nail beds, reduced circulation reaching your fingertips, clubbing, the gradual rounding of fingertips linked to chronic low oxygen, splinter hemorrhages, multiple unexplained dark streaks that warrant medical attention, Terry's nails, predominantly white nails tied to congestive heart failure and other systemic conditions, Bowes lines, horizontal grooves that may be the silent record of a cardiac event you didn't know you had. None of these signs diagnoses a condition by itself, but every single one gives you better, more specific information to bring to your doctor. They add detail to the picture, and that detail can make a real difference. Here's what I want you to do before today is over. Find a good light. Look at your nails carefully. Note the color. Note the shape. Note any lines, horizontal or otherwise. Write down what you observe, and bring that note to your next appointment. It takes 2 minutes, it costs nothing, and it may matter more than you expect. If you found this helpful, please share it with someone over 60 in your life. Not to frighten anyone, but because this is the kind of information that belongs in more hands. Thank you for watching. Take care of yourselves. Your heart has been working without stopping since before you took your first breath. The least we can do is pay attention.